Well, like many people here, I've been doing research on trying to prevent preterm birth for 3 or more decades. And for the first few decades, we all just worked out how you don't prevent preterm birth, what won't work. But then we started making some progress, we started understanding. And this program really began in Western Australia in 2014, when we launched a whole of Western Australia, whole of population program involving the healthcare workforce and the women and families of Western Australia. There's a massive education campaign with seven strategies that we applied to see if it would work, and it worked. In the first year, the rate of preterm birth came down.
We did some research that for the first time in New South Wales and Australia showed that babies born even a little early had different educational outcomes. That was published in a traditional research paper, and I was somewhat frustrated because no one read it, and it didn't change practice at all. And I realized that to be able to change practice, it wasn't something that a single person or a single team could do. It was something with which I needed to work with others.
It was a perfect fit for WHA to partner with the Alliance on preterm birth prevention. And then we engaged the IHI, the Institute for Healthcare Improvement, because they bring such rich expertise in how to make change in healthcare and how to make that sustainable. In addition, we were fortunate to have Safer Care Victoria express interest in supporting the collaborative, not only within the state of Victoria, but actually nationally, because they've got many years of experience in using the IHI improvement science with maternity services. So it's been a perfect partnership, a collaborative, if you like.
The goal of this program, the goal of the Australian Preterm Birth Prevention Alliance is one thing, that is to safely lower the rate of preterm and early term birth in Australia.
I think we're making some great steps. I think the collaborative's really taken on board the consumer movement, which is to really pay respect to consumers as an equal in the decision making, in the processes. True co-design is coming to a consumer at the beginning, not at the end.
This collaborative is actually making a difference on the ground. So the services that are involved, the maternal health teams that are involved, it's really changing people's lives.
We already have over 50 health services across Australia working collaboratively, and they've already begun to see reductions in early and preterm birth rates across the country.
Our goal is, by 2024, to reduce preterm birth by 20%.
This work is a world first, and to be able to be part of something that really can make such a significant impact, not only here in Australia, but really is a globally leading piece of work, to be able to reduce preterm and early term birth rates by 20%, not only because of the health outcomes and the education outcomes for Australians, but also in terms of the value it brings, the investment in this work and actually dedicating the time to this work is bringing better outcomes and better value healthcare across the country.
Based upon what's happened in WA and then ACT and Tasmania, it's going to be successful. I think it's fair to assume Australia will become the world's first nation to strategically lower its rate of early birth. You need to remember that preterm birth is the biggest cause of death in young children, one of the major causes of lifelong disability, and one of the major causes of people needing to be on things like the NDIS. So this is of great national importance.